tongue was swollen.
Okay.
And yes, it's all happened.
I'm really sorry to hear that, honey. But we are here to help you. Yeah. So what happened is diagnosed him with anaphylaxis, what we call in medical terms. This is a medical emergency, and it is a type of reaction which occurs to any type of allergen. Okay, so your son might have been exposed to some allergen, and he would have developed these symptoms. And this is a real emergency, and we are going to prescribe him EpiPen. Do you have any idea about it?
No.
Okay. Yeah, don't worry. So this EpiPen, this contains a medicine which can be used during the reaction that you observed last time. Okay? Is that all right with you?
Yes.
I can explain you everything about using the EpiPen.
Okay.
Okay? If you have any doubts, you can just stop me. I can just tell it back to you. You can, yeah, repeat it. All right? So first of all, you'll have to know what are the type of allergic reactions that you could that you can see. Yeah. So one of you said like he got swelling of the lips. The other reactions are he could develop loss of consciousness, confusion, shortness of breath, yeah, and some kind of itching and all these are some of the symptoms. Yeah. So once you observe these symptoms, yeah, you have to put Joshua and lying on his side, okay? And this is EpiPen, which you have to use, yeah? And it has two ends. One is blue and the other is orange, yeah? So always you have to remember blue to the sky and orange to the thigh, because you're going to use this orange to the thigh and you're going to give the medicine. And are you clear so far, honey?
Yes.
Yes. So I have to say that you have to check two things in this. One is the expiry date, okay, and the other one is this window, which should be clear all the time. If you see any color change or if it is any turbid or anything like that, then it's time to change it. Okay? Have you understood so far? Okay. So what we are going to do is you're going to take this cap off, yeah, and only then it works, okay. And when you're giving it, as I told you, you have to lie them on the side, and okay, I'll do this. So you have to hold the pen, any pen like a pen, like a real pen. Don't touch both ends, okay. Make sure, and you have to go at an angle of 90 degrees, yeah, and then choose where you want to give the injection. It should be clear of any scars or any skin infections or anything like that. Go here and then press it. Yeah, 1, 2, 3. Yeah, and then you can see the window will be closed, and you can't use it anymore. Yeah. So, do you think you can do this?
Yes.
Yeah. Okay. I have something. And you have to, after giving that, you'll have to call the ambulance and say anaphylaxis. Okay. If he is going to get any symptoms after that, you have to observe him for 5 minutes. If he's going to develop symptoms, then you will have to again give another EpiPen. So it's always good to have 2 EpiPens with you all the time.
2 minutes remaining.
So do you have any doubts so far?
No.
Okay. So few things I want to advise you regarding the EpiPen itself. Yeah. One is the expiry that I told you have to check, and you'll have to replace this EpiPen 6 months prior to the expiry date. It's always better to do that. Yeah. So as to make sure that we have the right expiry and we don't forget anything and it's going to be harmful for them. Okay. And it can be given to the pharmacist or in GP, and you can replace it. Once you use this, you can just give it to them, and they'll get the clear so far. Okay. And few more things. I want this EpiPen should be stored at room temperature. You can't carry it and it can't put it in extreme temperatures. Yeah, neither cold nor warm. Yeah, and these are the things that you should know about EpiPen. And it's always safe to carry two EpiPens, one with you and one who is very close to Joshua. For example, if is he going to school?
Yes, yes.
Yeah, so he started school. So you can give another EpiPen and you can warn the people around him where he usually goes and that he has got peanut allergy. Yeah, so make sure that he is not taking peanuts. You have to read the label when you get some food. Make sure it's even not traces of peanut. Yeah, are you with me?
Yes.
Okay. And it's always better to prevent the triggers more than treating it. I know it must be scary for you to see your
Move on to the next station.
Okay, excellent. So a bit of hesitation.
I know
Okay.
because I'm
Yeah. So no problem. It was good.
Yeah.
Whenever you teach anything, okay, I'm strictly against using the word you have to have to have. It sounds executive, okay? So if I say that you have to do it, that you're kind of making it mandatory, try to use a bit more polite. I know this is not very rude, but it sounds more executive when you keep doing it. Okay? If you want to use the word have to, then we have to. We have to. Okay? So we have to. When you are trying to talk about any child or any patient, anyone else with that relative, it's a good idea when if you create kind of team environment and say that as a team.
Yes.
Okay, so as a team, I want you to just
involve.
I want to involve you so that we as a team work together for your patient. Okay, so in this case, it is good you always take a recap of what they know. Always, always, when you're talking about any patient, be it this EpiPen or something else, okay, and you're talking about any situation, ask what do you already know about your patient, or what do you know about your situation, okay? It can be with the patient's relative or with the patient himself or herself, okay? Ask what do you know about yourself. What happened, why we want to do this, why we want to do that, has someone spoken to you, okay? What do you understand from the CT scan, what do you understand from x-rays, like those kind of things. In this situation, it is important that we ask them, what do you understand, what happened to Joshua? No, this is very important, Shashwati. It's very important, you're moving everything, okay? No, no, it's not. It's not. Sorry, does not work. We spend a lot of time on that.
I didn't realize it was on.
We'll get permanent solution. Okay, so take a bit of understanding from the patient. What do you know about your child? Tell me what happened with him when this happened, and then make sure that what you're trying to do is, what do they know about the gravity of the situation, about the severity of the problem, okay? Then you are going to use the same information as you told that he was feeling this, as you told he was unwell. So these are the signs and symptoms that you need to look for. And if you suspect any of them, if you see any symptoms, this is when you need to use an EpiPen. Okay? EpiPen is a device, it's a drug delivery device. Now, there are two buzzwords. One is for the condition, the buzzword is a life-threatening condition. Okay? And this is life-saving medication. So that they understand the importance of both of them. Okay? So mention that anaphylaxis is a type of allergy. Okay? On one side you see just some mild rashes. On the other side you see this kind of reaction where can be fatal, it can be life-threatening, and unfortunately, Joshua has surgery. But I'm glad to see that he is doing great. He is well. So there is nothing much to worry about. However, there are few precautions. This can happen even by touching if the patients are allergic to. Okay, sometimes it can happen even by touching. There are documentaries. There are long
Touching
documentaries.
what, sir?
Touching the
Penis.
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 If
Yeah, I've heard like.
yeah,
Even in
no,
the
there are
school,
there
if
are long
someone.
documentaries on the BBC and
Yeah.
so
Even if someone is eating something in the school days, has to.
yeah. So
Yeah.
if you so which is why you are going to focus more on not only eating but also on the symptoms.
Yeah.
Okay. So if you see any worrying symptoms, give it. Okay. If you are in doubt, give it. Okay. So make sure that you keep this all the time with Joshua wherever he goes. We need to keep two of them. Okay. Guys, keep your mics muted, please, unless you want to say something. Um, okay. So keep this all the time with you. Okay. You have to have two of them. Okay. You cannot separate. You cannot divide one to mommy and one to daddy. Okay. This is for Joshua. Wherever Joshua goes, whether he goes with mummy, he goes with daddy, goes with uncle, with auntie, whoever. Okay?
Okay.
So there have to be two. Ambulance may take some time sometimes, okay? There may be the breakdown, there may be some other issues, so it may take some time for the ambulance to arrive. Okay? This is a life-threatening condition, what we are talking about. Okay? So do not give them such doubts that they cannot separate and get okay. And
So after giving once, how what there's a time duration that I mean
yeah, we'll talk about that. Okay, we have to reach that. Okay, now I teach you guys in terms of the 5 P's. Okay, 5 P's of any examination, any teaching stations, any procedure. Okay, there are 5 P's that I work on, that I teach you on, that you need to keep in your mind, and if you keep hold of those 5 P's, then you will never fail to share any information or to do anything. The first P is a previous knowledge, understanding of the previous experience. Okay, yeah. And that applies everywhere. Okay. Any previous knowledge, previous understanding, previous experience. So when you're talking about this, ask Dad. Dad, do you know anything about? Have you heard of this? Okay. And you know, sit. And the second P is a prerequisite. Okay. Prerequisites are what we need for this. That includes everything, all the rights. Okay. Right patient if you are performing the procedure, right patient, right exposure, right material, the equipment, you need the stethoscope, take that, you need the tendon hammer, take that, you need a glass of water, take that. So everything that you need, okay? Right exposure, right position, right patient, okay? And right symptoms and the indications, and you explain. Similarly, in this, what are the prerequisites? Okay, so we explain that this can be given in any position. Okay, so that's a prerequisite. Don't worry, this can be given in any position and can be given with the cloths on as well. Okay, yeah.
can
So
be given, sorry?
with the cloths on, okay, you
The
do not
clothes
need
on.
to, yeah. So you do not need to expose it. Okay, so the position and the exposure should be covered in the prerequisites. Any procedure, okay, and then the third P is precaution. Okay, for anything. Okay, if it is a procedure, then the pain is a precaution. Okay, do not use uh, for the subcutaneous injection, ulcerated part of the body, the skin is a precaution. Do not use that. Okay, check the expiry, check this and that. So in the precaution, you're going to mention about the expiry. Okay, ask them, check the expiry. Expiry is in here. So you were dodging me, and I know that. Okay, expiry is in this red strip. On this. Okay, so check the expiry. Check the color change. If there's any change in the color, that's in the white window. And here, guys, this window. Okay, because this is just a trainer pen. That's why you cannot see. Otherwise, there is a clear glass.
So, for example, in the exam, we don't know anything like in that tension. If you're not able to see correctly, we just say expiry, then the examiner will know.
Well, if I knew that, yes, of course, I will know that you're dodging. It is dodging.
Okay.
All right. So check the expiry. That's a precaution, and make sure that you take it down. Okay. So this is a locking key. Okay. Locking key of this. So before you talk about these things, just mention that. Mention about the parts of this. Okay. This is locking key, and this is a pen itself, and this is a cover for the needle. At no point you will see the needle at all. Okay, the needle, there is a needle that's very small, very thin needle. Okay, you don't need to worry about it. It's not going to harm anyone. Okay, so it is important that you keep it all the time with you, 24/7. Wherever Joshua goes, it should be with him. There should be two of them. Okay, and before you inject, make sure that you remove the cap. Start from here. So there are three things from there to there. Okay, so remove the cap, check the expiry, check the color. Okay, so these are the precautions, because if the cap is still there, it will never function. Okay, they will not know how to use it, and you will fail, definitely fail. Okay, giving you a car without the training, without telling you where the key will go, okay, does not make any sense. Okay, so hold it firmly. Okay, after removing this, hold it firmly in your fist. Okay, swing it to the side and just press against the thigh. Okay, if there is anything you can show on that, or otherwise show on this. You can tell him that this is a trainer pen, it does not have any needle, so do not worry. If you want to try, you can do that.
Okay.
Okay, so there is no needle in this. Alright, okay. So in the third P, there is one more thing that you need to add. Make sure that there is no coin, no toys on it. Sometimes the kids may keep the coins and the toys and stuff like that, because this is very important medication, life-threatening medication. If you press against any coin, the needle will bend and the drug will be wasted. Okay, make sure that you check everything. There is no zip, no coin, no metal, no toys in the pocket or in that area.
Zipper system.
Yeah. Okay. So that's the third P. The fourth P itself is the procedure. Okay. You explain the procedure, how to give it, and tell about all the steps of the procedure. So you take this out, check the expiry, check the color, and if everything is okay, take this out and hold it firmly in your hand and press it against the thigh and keep it for minimum 3 to 5 seconds. Minimum time is 3 seconds, okay? After you hear the click, and you need to make sure that you show them how to get the click, okay? You need to make it click there. And the fifth P is the post procedure. What are you going to do post procedure?
Call for ambulance in this case.
Make sure, yeah, call for ambulance, even if your child improves. Okay, call for ambulance.
Repeat within next
5 minutes.
After, observe for 5 minutes. Okay, and in the meantime, if Joshua starts throwing up, lie him on his side. If he starts feeling dizzy, lie him on the floor and lift the legs up. Okay, and it is important that you do not panic. If you panic, this can be dangerous. Okay, this can be very easily controlled as long as you give the medication on time. This is very good medication, so it is important that you keep this all the time. Okay.
I have a doubt. in the position when we are giving.
Uh,
So is it like lying flat on the floor and
No. You can give even while the child is standing, okay?
okay.
You can give in any position, okay? However, if your child feels unwell, if he starts vomiting or feeling sick, then lie him in the recovery position. If he is feeling dizzy, cold, clammy, okay, lie him on the floor and lift the legs up,
Okay.
okay, so that the circulation to the brain recovers. Does it make sense? Any question?
So the thing when we give the next one after
5 minutes. 5 minutes. Okay. And the other thing is, as you mentioned, do not expose to the extremes of temperature. Keep it on the room temperature. High, very high and very low temperature it can cause damage. Okay. So the drug may expire.
For the allergen when you're buying any
Yeah.
food.
Yeah, that's a general precaution. We're talking about that.
Okay.
That is a general precaution. Okay, guys, any question?
So in the real EpiPen, it would be like the same doctor. Or
They will not
they
give
will-
you
Yeah,
real
yeah.
EpiPen.
Okay.
Okay.
I'm just asking.
This
like,
will be a clear window.
Yeah.
Okay.
Yeah.
This will be a clear window.
Okay.
And the needle will be like
No, inside.
Yes,
You can't
needle is hidden
inside.
in
Inside.
yourself, inside. You never see at no point you see the needle. What do you need? Okay, put your charger on that box. You can connect. Okay. Just take the cable out and connect it.
So how to tell her about the recovery position?
Lie him on side.